Good morning and welcome to COVID-19 Talk with Local Health Authorities. Joining us is Dr. Janita White, who's actually the Deputy Health Authority for the City of Houston, who is standing in for Dr. Erica Brown over in Harris County. We certainly have Dr. David Purse, the Health Authority for the City of Houston. Special thanks to past President Rotary Club of Houston, Kathy Finninger, for providing us these questions, and Morgan Ash, our producer. I'm Stephen Williams, the Director of the Houston Health Department, and happy spring break to everyone. Let's start off. Vaccines, third and fourth shots. We're getting a lot of questions about this. The U.S. Department of Health and Human Services says it is time to get a booster. Since shot number 3 makes me fully vaccinated, is this shot number 4? Would I be rejected from getting it now without an underlying condition?
So I'll jump in on that one. So there's a little bit of confusion about the terminology. So actually being fully vaccinated means you got your first 2 shots. Now, for some folks who are at high risk that their body didn't respond properly to those first 2 shots, they are recommended to get a 3rd shot. That is not a booster for them. That is a 3rd shot that then makes those folks be what we would call fully vaccinated. Beyond that, so a 3rd shot for the folks who were fully vaccinated with the first 2 shots, that 3rd one, that's the booster. And for those subset of people for who are high risk, the vaccine primary 2 shots not working, who got a 3rd shot, making them quote unquote fully vaccinated, a 4th shot for them would be a booster. So a little bit of confusing terminology there, but if you depending on where you fall on that, and Morgan has put up a graphic that kind of explains this, that's available on the web if you want to get into it in detail.
So I guess, Nina, you have to summarize what he just said in 1 or 2 sentences. When do we need to get a booster in Houston?
So actually, the summary was great. I think what the person may also be asking is, if I did all that, but there's been so many months, is the CDC recommending I should get an additional dose? And unfortunately, the CDC hasn't come out with that guidance to say you should get an additional dose on top of that booster. But certainly that is in the discussion and the conversation, because we've been in this 2 years now. We've been vaccinating for more than a year. So we do know there are individuals who may feel that they've been past 6 or 8 months now, and they are asking that question, that very question.
The requirement for a pending international trip is having had a vaccine less than 270 days after the full primary series. I am young with no underlying conditions. Should I just go ahead and get another shot?
So for this person, if you've got your primary series, you should go ahead and get boosted. If that additional shot that you are referring to for you is the booster shot, then yeah, you absolutely should get it. Now, 270 days, that's 9 months. So I can't imagine somebody got boosted more than 9 months ago. So I would say, yeah, go ahead and get your booster shot, just like you ought to.
This is booster day. Should
Yes.
people get vaccinated and or boosted if they recently got over COVID?
So we'll both say yes.
Yes.
At the same time, we have seen, even if you've gotten COVID, it does not mean you should not receive the vaccine series. You absolutely should get vaccinated.
Mask and preventives. This program started 2 years ago, and we quickly went from discussing sanitizing our food to benefit of wearing a mask. So are both of you still wearing a mask? And if so, under what circumstances?
Yeah, so, through this whole thing, I've tried to be pretty transparent and talk to folks like I would talk to a member of my own family. And so here's the deal. This past week, I have let up on my mask wearing a little bit, but don't take that too much. So when I'm not wearing a mask where I used to, it's if I go out to a restaurant, if I'm going to go out to lunch for a restaurant, number one, I continue to eat outside. Number two, I don't go at noon. I'll go at 11 o'clock or I'll go at 1 o'clock to avoid the crowd. Same thing with dinner. On the weekends, when my wife and I go to dinner, we don't go at 6 o'clock. We go at 4:30. So I've let up on mask wearing a little bit. When I come to work in the morning, for example, in our office building, I get here a little bit after 7. That's on purpose. If I get here a little before 7, there's a rush for the people who have to be at work at 7. The elevators are crowded. I get here a little bit after 7. There's nobody on the elevators. So I may not wear the mask on the elevator, but it's generally empty anyway. So I've let up on my mask wearing a little bit, but I'm paying really close attention to how crowded it is. And if it's crowded, I have my mask on.
And likewise, I actually echo Dr. Purse, because I'm in an environment in the healthcare sector working around a lot of individuals, you know, the consideration for not knowing what other people's health concerns are. I also feel a shared responsibility that I want them to also feel safe. So we are taking, you know, in-person meetings. We do have opportunities where we have to go speak to groups. And so I'm still wearing my mask because there's still community activity that we're seeing. I don't know always who's in the audience. At my home, it may be more intimate settings where I know people's vaccine status. I may be more inclined not to wear a mask, but certainly I want to have a shared responsibility to other people and their considerations about their health.
You know, it was interesting. I went to an event at the George R. Brown Convention Center yesterday. It was a reception. It was quite crowded, and I was probably one of maybe 2 to 3 other people who was wearing a mask. And of course, I had my health department mask on, and so it didn't stand out very much. As a matter of fact, one of the people I was talking to ended up putting his mask on since he said that I had mine on, and maybe I knew something that he didn't know. But I didn't know really, because it looked like it was a couple of hundred people. So, you know, what can I say? Airlines for America asked for the end of masks. What do you think about this?
I mean, currently still the, you know, travel considerations for aviation and I think buses and certain public transit is still requiring masking. I think it's sort of the same caveat for me that I just mentioned. You know, you're around a lot of people that you are not quite clear what their risk factors are. And certainly for aviation, people are global. And so there's still communities around the world that are still seeing significant exposure for COVID. So you just don't quite know who you're exposed to. I mean, travel has been pretty safe, but I think they're just making that extra precaution for all minded people. But I know the CDC is working with the FDA. Dr. Purse, I don't know if you've seen this. They are probably going to be re-looking at some of those considerations in the next few months. But I think right now it's the shared responsibility of asking for safety in a global consideration.
Basically, y'all are telling us that, you know, be thoughtful about, you know, what you choose to do.
Mm-hmm. I mean, some of these airports, right, are mini cities. I mean, when you're walking through an airport in certain areas of the country, I mean, there's a lot of people that are moving through there, and just a lot of opportunities for potential exposure that you have no control over. So I think they're just asking for another layer of protection for us.
And the other thing, you know, when we do our wastewater testing, one of the unique areas is the wastewater treatment plant that serves basically just, you know, Intercontinental Airport. Mm-hmm. And that one frequently has, when numbers are low across the city, that one frequently still has virus because it's a global airport. It's an international airport. So if there's an outbreak going on across Europe, guess what? We're going to have people using the bathrooms in Intercontinental Airport that are going to have COVID that even in the community like Houston right now today has very low levels.
Mm-hmm.
So I'm traveling in about 12 days, David, and I'm glad I'm going out of hobby.
Well, I'm traveling tomorrow out of hobby and I'm wearing a mask.
I'm going to wear a mask too. For the 9 hours that I'm going to a city where the connections are not really that great. I think it's going to take me 9 hours, and so that N95 is going to be stuck to my face. I work at a pool, and no one has gotten COVID. Could this be chlorine related? I'm sure that pool's outside.
Yeah, you know, I doubt it. There's no virus that likes chlorine, so I am sure that the pool water is quite safe. But the thing you got to keep in mind, though, is that this is spread from a respiratory. So the virus is in somebody who's infected. It's in their lungs. It's in their throat. That's where it is. It's not in the pool water. So all the chlorine in the pool water is great, but that's not where people are getting infected from. Now, the other risk with pools, especially with younger folks, and I remember being a young kid, and I've been a dad, and I watched my daughter in the pool, and what do? They splash around, and they get water, and then they start coughing and hacking, and you're right. And if they're infected, they're spreading it. So I'm glad to hear that nobody at your pool has gotten infected, but that's probably due to a bunch of other reasons and not the chlorine.
Okay, good one. Has vitamin D now found proven to be a preventive? Question mark. What about black cumin?
So I've not heard of black cumin, and the question about vitamin D, I have to remind myself, there is a lot of data coming out with regards to vitamin D and vitamin D in the construct of just chronic illness and inflammatory considerations. One of the things I think I have to be very careful of is data is coming out so quickly than what we're used to that we still need time to really look at it in a longer term and longer scope and what it implies for COVID. So we're getting data so much more quickly, research studies than we had previously seen. And so you'll get a one-off, a meta-analysis that does demonstrate some concerns about vitamin D deficiency. But I think there's more to come as we just get a little bit more time to see what the data absolutely means. But vitamin D is not new to the construct of your health and what it means to be vitamin D deficient. But black cumin either. I'm not versed enough to know what that might mean in the space of COVID.
The only thing I can add to that, and I echo everything Dr. White said, is that there's been a couple of studies that have looked at, well, actually, there have been quite a number of studies looking at vitamin D, and there's mixed results, quite honestly. But the one thing that seems to be a trend is that for those folks who are vitamin D deficient, getting your vitamin D gets your immune system back to where it should be. And of course, we know that vitamin D is part of the support system for your immune system. So that is not a surprise. But that gets mixed, right? People then take that and say, oh, vitamin D is now a cure or a preventative for COVID. And that's not exactly what the research is saying. Now, the other thing is that if you have a well-rounded, healthy diet, you should not be vitamin D deficient. But if you're living on the diet of, maybe that of a teenager, which consists of sodas and candies, you're probably going to be vitamin D deficient. But for the rest of it, you got a healthy diet, you should not be vitamin D deficient.
Pfizer oral treatment within 5 days is said to be effective. Is this over the counter?
No, it's not over the counter. Now, we just checked, and Dr. White and I were both on a conference call just a little bit ago, and we know that there's plenty of the treatments available, but it does require prescription.
Okay. Is the dosage being raised for under 12-year-olds to make it more effective?
If the dosage under 12?
Under 12, yes. You remember?
So the vaccine, right. So from a safety perspective, we know the vaccines are safe. It's efficacious in the sense of being efficacious in immunogenicity for the younger ones. What they found is when they looked at the spacing of the dose or the dose strength, they're still having to do more studies because it may be that the 5 to 11 has a 10 microgram sort of dose. We were 30 for adults. The 10 seemed to hold steady. When they took it below 5 and they went to a reduced dose, it seems that dose may not be strong enough to give good immunogenicity, meaning that they may need 3 doses, not 2 doses for the vaccine, and that's what they're looking at. But what they bottom line do demonstrate is the vaccine is safe. Now is the time to find the right schedule and dose for children under 5. Or strength for children under 5.
Okay. Continuing on, pediatric cases seem to be increasing. Is that because the vaccines are not eligible for this age?
Pediatric consideration is still mixed. When you look at the numbers across the country, kids are getting infected, kids are getting exposed, and we don't want to take that lightly. We did have a call recently, and there's this misunderstanding that, it doesn't seem like a lot of kids as compared to adults, but it's still way more kids than we've seen in other vaccine preventable infections. And so we're really trying to make sure people understand that kids are still at risk. We certainly see a younger group, but there's that mixed group that they're vaccine eligible, and we're seeing those children infected. And that's where we're trying to get the message out to parents that this is vaccine preventable. And the children who currently can receive a vaccine, it's important that they should get their vaccines and get their booster, if applicable for them. And let me just also say the one concern we're also thinking about is, there's this MISC, there's some considerations about what may happen for children in long term after being exposed. Again, it may not be as impactful as adults, but is one child too many, especially when we still don't know those additional variables and what that means for brain integrity, for chronic disease and long-term complications. So again, we're so new into side effects and what we're seeing for children who get infected that, again, one child is too many.
BA2 jumped to 23% and seems to double each week. Could this wipe out all other, including the original version? Is that true for the US?
So it would make, so BA2 is a little bit more easily spread than BA1, Omicron BA1. And that's why it's making the news. And we're seeing in Europe and in some places in Asia that it's taking over. And it is not a surprise because it spreads more rapidly. So I think that, yeah, at some point it is. Now, it's going to be interesting to see what happens here in the United States, particularly in Houston. Because when we look at what's going on in Europe, when we look at what's going on in parts of Asia, the amount of previous infection, the amount of vaccination, the type of vaccines been used, it's different in all these places. So unlike in the very beginning, when there was no vaccine and there was no human immunity, no herd immunity at all, we were all kind of the same playing field. Now it's very different from one country to the next as to what the situation is. So here in Houston, BA2, it's here. It's been here for a while. It doesn't seem to be taking off. Now we're watching it really very carefully. Very low percentage of cases are BA2, and it's not taken off. But it wouldn't surprise me that it might at some point, and certainly in other parts of the globe, I fully expect that it will. But again, there's a different situation than what we have today here.
Putting you on the spot because I can, what is your level of concern for here in Houston?
So, it's my job to worry. So take what I'm about to say with a bit of a grain of salt. So I'm worried that we still have a lot of folks in Houston who are not vaccinated. I'm really even more concerned about those folks who are vaccinated but not boosted. We do know that if you're boosted, while you may still become infected with Omicron, whether BA1 or BA2, you don't get terribly sick. But for those folks who are primary vaccinated only, they are still getting, pretty symptomatic with it. We have folks who have immunity from Delta and Alpha who think that they're good to go and that they're ironclad. That is not the case. If you are infected with BA1, you're probably pretty well protected against BA2, but that's really the only part of our community that's probably got solid protection against BA2. Those who are boosted, you're probably second best protected. And then I think everyone else, primary vaccination only and previous infection with Alpha and Delta, I don't think you're terribly well protected against it. So that's what I worry about. But we're going to have to wait and see.
Okay, Nana, you get your turn too.
No, I completely agree. But what I was thinking of, to what Dr. Peirce is alluding to, is that we actually have much better systems in place. So we're looking for it. We know we need to pay attention to what's coming with our genomic testing, and we're testing and looking, and we have tons of partners in our region right now. So I think what we didn't know before is that we have the benefit now of these amazing partnerships, and we know how to be prepared and look for sort of early signals, and that gives me confidence because I know we're looking.
Wastewater news.
There you go.
Your favorite, David.
Yeah.
So the wastewater, the couple of things, 3 points. One is that locally our number is down to 19% of the July 6, 2020. There it is, right there on the screen. And that's the lowest we've had since the beginning of the pandemic here in Houston. Also, we are looking for BA2 in the wastewater, and we have not found it yet. Now, I know that it's there because we know from our hospital partners they have a small number of people who are infected with it, but it's just not enough that we've been able to detect it in the wastewater. And then the third thing is it made national news that the CDC is reporting across America that they're seeing increasing levels of virus in about a quarter of the communities that are doing wastewater testing. So we haven't yet seen that here in Houston. Maybe we will, but I think it does go to the fact that this wastewater surveillance program, which really started here in Houston for COVID, has now taken on a national presence, and is probably our single best predictor of what's going to happen over the next couple of weeks.
Okay, I'm going to go a little faster because I asked extra questions and follow-up questions, okay? About 65% of the global population has been vaccinated, and adding together all who have received a vaccine and who caught any version of COVID, what is projected as the possible population that could still catch it? I think you kind of answered that when we were talking about BA2.
Yeah.
Exactly. Yeah.
What is your opinion about the effectiveness of China locking down a city of 9 million people?
You want to take? I'll take that. So
Both of you are smiling.
So you're both like, go ahead, Dr.
Fair
Fritz.
opinion.
I'll tell you what, I think it's really fascinating. We look at South Korea, Hong Kong, and China and what they've done over there. The idea of really locking down a community with very small numbers was extremely effective. What has not made the news is they would lock down these large communities, huge communities, for a brief period of time, eradicate the virus using traditional public health methods, but on a grand scale. And then they would open up society again, completely open for several months until they would have another case. They would lock it down again. Extremely effective. But today, however, and then during that time, vaccine came along. And so they started making vaccine available. But today they're in trouble. And the reason that they're in trouble, and I don't know that it's going to work at this point, is that BA2 spread so effectively, and their previous methods were so very effective that they've got really poor vaccine uptake in some of these countries. And that's what, because BA2 spread so effective, I think it might beat this lockdown technique. And in the absence of a lot of vaccine, I'm fearful that they're going to be in trouble.
And I know, Stephen, you want to go real quick, but remember, this community had other pandemics. They saw MERS in such a way. They have a playbook that they pulled to a new playbook. So they've seen it, and I think that's one of their considerations is not seeing it again.
Okay. The UK always seemed to be a bit ahead of us. They dropped the 5-day isolation for testing positive and now have a surge. What does that teach us?
Right now, it teaches us to stay our course. I think we're showing that science is leading, and we've got evidence that we are just going to lead with science in such a way, right, to have not that risk and sort of back channel some of our strategies that we have that is allowing us to have things open up.
What's the best way to tell a family member they need to get vaccinated before coming around my little kids?
I would say you tell your family member, I love you, I worry about you, but I love my kids more, so get vaccinated.
I noticed that the RT levels from TMC have gone up significantly this week. Is that because we're taking masks off more? Is the RT actually up?
Yeah, I don't think you can put that together as the reason. And certainly the hospitals they're still full, but they're managing and they have staffing and they seem to be holding steady.
Okay, good question. If the vaccine was created specifically for the original SARS-CoV-2, how is it working on the current variants?
Yeah, so this goes back to the question, if you're boosted, if you got your primary series and you're boosted, you got great protection against requiring a visit to the ER or an urgent care center, getting hospitalized or dying, but you'll probably still get symptomatic. I look forward to the day when we have Omicron specific or a more broad-based COVID vaccine available.
Which communities in Houston have been the hardest hit from COVID? How are public health workers reaching them? Actually, we're trying every method possible. We're using mass media. We're using, Texas, Facebook, everything that we can, and including going door to door in some communities, visiting various businesses in some communities. And now we're going to start a strategy where we're going to try to get trusted community advocates actually involved in this and people that are actually located in the community.
Good.
What are your thoughts on the rodeo? Do you think there will be an uptick in cases following the event? That's for you, David.
Yeah. I really don't think we're going to see an uptick in cases due to the rodeo. The rodeo is a big gathering, but this is a city of 2.3 million. This is a broader community of nearly 5 million. We've had, almost no restrictions. If we were going to see an upsurge, we'd already be seeing it. I do think, and I said this, I do think we will see an upsurge again, but it's not going to be because of the rodeo.
Is it safe to travel right now? I think you talked about that. Yeah. You're saying pretty safe, but mask up on that plane.
Absolutely.
Yep. The World Health Organization said they haven't seen any change in the severity with Deltacron cases. And epidemiologists at Harvard said it's only a variant if it produces a large number of cases. So if it's not causing lots of cases, people don't need to be concerned. What are your thoughts? I think you addressed that earlier, right?
Absolutely. And we're watching for those type of variants. So variants of concern, interest, and variants of concern.
What were the death stats due to Omicron? Same or worse than Delta?
It was less than Delta. It was actually, it spread much more rapidly. A lot more number of people got infected, but the percentage who wound up dying was much less than what we saw with previous variants. So that was totally by luck. It's an important thing that we need to understand is that that was completely by luck.
I still see so many trolls on pro-vaccine social media posts. Is there anything we can do to help change their mind?
Sure.
We're working on public messaging. We're working on trusted ambassadors, just trying to make sure when there's misinformation, we counter it with actual truth information. So we're all engaged in getting the truth out.
Related to that, how should a regular person react to obvious misinformation on their social media feed?
I just don't take the bait.
Our social media feed. Attach to our social media. We've got, link to us and share it.
Even mild COVID can lead to brain changes. Please elaborate.
Yeah, so what we're seeing, there's not a correlation between how sick you got and whether or not you get post-COVID issues.
Dr. Peter Mccullough said vaccine causes spike proteins to linger in the body for over 12 months, possibly weakening the immune system. Any truth to this? If so, why?
Yeah, Dr. Purse, I've not seen Dr. McCullough's.
Yeah, I know a little bit about him. He's okay. You just Google him and you'll see he's extremely controversial. Okay. He is spreading what a lot of folks consider to be poor information, and I wouldn't. And this one point that it causes spike proteins lingering in your body for over 12 months. That is just a ridiculous sort of. No, that's wrong.
I could tell what you thought by your initial reaction, David. Can we now call this endemic?
So it feels endemic in our locale, maybe, but accordingly from the World Health Organization, they've not changed that nomenclature. It's still considered a pandemic. Yes.
Okay. But there's an important thing. I'm sorry to interject. When we say endemic, people need to understand that it does not mean mild. It means it's permanent. So measles is endemic. It is, but a measles infection is still very serious. AIDS, HIV is endemic, but it is still a very serious illness for which there can be terrible consequences. So don't mix up the word endemic with me thinking, oh, it's okay, it's mild now. Those are two different things.
I think that's a very good point to stress. I do. Okay, if you could turn back the clock to 2 years ago today, what would you tell yourself? What would you do differently? How would you respond differently if we had another pandemic in our lifetime?
It's not necessarily a difference. I just see